Well, good afternoon. I'm Olive Sykes, and with me today is Scott Sykes with Sykes and Company, and also Tim Hawley with Exemplar Insurance Associates. The Master of the Margin series that we have here is going to take a little bit different path today. We have learned about Exemplar as we've been in the field, trade shows. We've met with the originator of this particular company from time to time, and we have various clients that are intricately involved with Exemplar right now. We find the concept of what they're doing very interesting. So we invited Tim as CEO of the company to come on today to begin a presentation to update everybody on this call today. So as usual, you can send questions to Ask Sykes at sykes-cpa.com. You can put questions in online on the GoToWebinar platform. We'll answer as many of these as we can, but I think there's going to be a lot of information crammed into this short presentation of 45 to 50 minutes. You registered, so you'll get an actual copy of this. Let me say before I hand off to Tim, we have no conflicts of interest here at Sykes & Company with Exemplar or any other vendors. We talk very openly, good, bad, and indifferent about vendors that perform and ones that don't perform. But we just want to make that clear on the front end today. So with that said, I'm going to hand it off to you, Tim.
All right. Well, thank you so much, Alan. Once again, my name is Tim Hawley, CEO of Exemplar Insurance Associates. Very, very excited to be asked to come and talk to everybody that's on the call today. Really, the weeds are about 10,000 foot deep here at Exemplar and what we've tried to build for independent pharmacies and independent physicians nationwide. So as Mr. Sykes alluded to, there is going to be a lot of information that I'm going to try to cram into a very short period of time, which is hopefully going to spawn a lot of questions and a lot more follow-up. So please feel free to shoot those questions in as we go through the presentation. You're going to hear a lot about Exemplar today, and you're going to hear a lot of acronyms for Exemplar. You're going to hear Exemplar Insurance Associates, Exemplar Health Benefits Administrators, Exemplar Health. Those are all companies that support the overall company of Exemplar. And who is Exemplar? And Exemplar at its root is nothing more than a network. Nobody owns Exemplar. The network is really just consists of independent pharmacies and independent physicians nationwide. Exemplar, we also branded it as the Healthcare Partnership Organization. Okay, and that's going to be very important as we go forward to know that we are willing to partner with any other vendors that are out there to basically support the independent pharmacies and independent physicians that are part of this particular network. Exemplar also, if you look up the definition of Exemplar, if you look up the synonym for Exemplar, Exemplar stands for paradigm shift. And what we've really tried to do is create a paradigm shift in the industry to help our network members, you, the independent pharmacies, and of course, the independent primary care physicians as well. Next on. So what is the overall arching goal of Exemplar? Obviously, it's pretty basic, simple business concept. All our members want more lives and better reimbursements. And kind of the running joke at Exemplar is, you know, that's not the paradigm shift. That's not a new rocket science business concept. If you're a lollipop salesman, you want the same thing. You want more lives and you want better reimbursements. So really, what is it that we're doing at Exemplar to bring you more lives and better reimbursements? Next. So in order to understand how we do that, we really have to understand the current market conditions that are out there that really even allowed Exemplar to form, if you would. So let's take a look at the current market conditions that are out there. Currently, you know, our competitors, your competitors, are the big retail chains. So if you look at the business design that CVS has created, and they did it brilliantly, in my opinion, by the way. CVS has roughly about 9,000 retail chains nationwide, and their ultimate goal was to control all the dollars in the healthcare marketplace. almost to the point where, Congress actually considered them a monopoly at one time, or have looked into them as being a monopoly. So in order to control those dollars in the healthcare space, they obviously had their distribution of stores nationwide, and they said, okay, well, we need to own a PBM. And you guys are all very familiar with PBMs, so I don't need to explain to you how PBMs work. So they went out and purchased Caremark. And then, so now that they have the healthcare dollars on the prescription fill side taken care of, they needed the dollars on the medical side. So CVS Caremark went out and purchased Aetna for $79 billion. So CVS, very smartly, they went out and took care of the healthcare dollars on the prescription drug side. Now they have the medical side. Now the missing piece was kind of the sourcing aspect, or the wholesale distribution of the healthcare circle that they created. So they own Red Oak, which you guys are very familiar with. So next, Alan. So then if you take a look at Mr. Walgreens thought that it was such a good business concept. They duplicated what CVS did, and they went out and they purchased Express Scripts. That's their PBM, of course. Express Scripts then went out and purchased Cigna. And then they have, of course, WBAD as their sourcing company. So here's the challenge that we realized at Exemplar 2 years ago when we launched the Exemplar Network at PDS February 26, 2 years ago. Is we realize that you as independent pharmacists, when somebody is walking in with Aetna and you're filling their prescription, you're getting reimbursed by Caremark. Well, who owns Caremark? Your competitor, CVS. And a lot of times you're purchasing your drugs through their wholesale distribution company. So really, in simplistic terms, a lot of times the independent pharmacists are working as 1099 associates for their competitors. And some business owners, for 2 years, I've been all across the country talking to pharmacists. Sometimes they realize that this is going on. And quite frankly, sometimes they don't realize that it's going on. Next. So what we did at Exemplar is really we had to create an opportunity where we could win those lives and bring the independent pharmacies more lives and those better reimbursements. So what we've done is basically we duplicated the same exact business model. You'll notice that Exemplar, the network, is our network of pharmacies nationwide. Like I said, CVS has 9,000 pharmacies nationwide. Walgreens has roughly 9,000. We still feel like there's about 20 to 21,000 independent pharmacies nationwide, and we have independent pharmacies joining our network every single day. We're growing by about 100 pharmacies a week currently. Doesn't cost anything to join the network. They simply, when you join, you just want more lives and better reimbursements. So what we had to do is basically we had to go out and find a PBM. We had to duplicate the CVS Walgreens model. Well, it's very, very difficult to find a PBM out there in the marketplace that wanted to partner with a network that was going to be fully transparent and give a better cost or better reimbursements to the network. So we started our own PBM, and our PBM is called ProRx Solutions. Then we needed the medical piece. We needed the insurance piece. So we actually purchased a insurance company domiciled out of Texas called Presidential Life Insurance Company. And then, of course, we need the wholesale drug distribution company. And we actually, under the Exemplar umbrella, actually own a wholesale drug distribution company called Independent Pharmacy Distributors. So now the name of the game, now that we have basically completed the healthcare circle, is if you look at CVS, you look at Exemplar, and you look at Walgreens, now it's simply a battle of lives. We need to win lives, because once you win lives, those healthcare dollars stay within that circle. It's very, very difficult for those dollars to leave that circle. So next, Alan. So basically, how do we win more lives? And this is really where I've had to take a deep dive into your customer population and really understand who your customer population is so I can help you guys win more lives. Next, please. So, just after, like I said, I come from the insurance side of the world. I'm not a pharmacist by trade, but speaking with independent pharmacies for years, we've come to realize that in simplistic terms, you guys are getting paid in 5 different buckets. And these are your customers that are coming into your store. And some of your customers that come into your store have commercial health insurance, group insurance through their employer. Some of the folks that come into your store have individual health insurance, maybe through the marketplace or maybe through a Christian healthcare ministry plan, a defined benefit plan, a lot of options that are out there. And then a big portion of your patient population, at least that we found statistically, is in the Medicare population. Then you're getting paid in the Medicaid population. And then you also have a certain number of customers that are cash paying customers. So my job as CEO is every day I wake up, I say, how am I going to bring our network more lives and better reimbursements? So I take a look at the commercial health bucket and say, what can I build or what can we bring that's unique in the marketplace to win more lives in the commercial health space? And I do the same thing for individual health, Medicare, et cetera. So right now, I can tell you that Exemplar has fantastic solutions in 2 of those 5 buckets, one being the Medicare bucket. We do have a PDP plan that is launching with no DIR fees in North Carolina and Texas for this coming year, 2021. But that's not what I wanted to talk to you guys today about. What I wanted to talk to you about is what we've done in the commercial space, in that commercial bucket. And we truly have the best in class solution available in the United States today. And I can say that with a lot of confidence. I've been in the business for 25 years. And I'm going to show you today how we're winning business across the United States that's bringing you more lives and better reimbursements. Next. So what we have is what's basically called a level funded solution. And what I want to do today is I just want to educate you and empower you. As you know, your pharmacist by trade, and insurance may sound a little bit Chinese or a little foreign to you, just like when I talk to pharmacists and they start talking to me about AWP and MAC rates, and it's a different language altogether. So I'm basically going to keep this very, very simple for everybody. These are the options that are available to group employers that are out there. There's really 4 options. I have 3 on the slides. A group can be fully insured, they can be self-insured, they can be level funded. And what I'm seeing more and more, which is kind of depressing, is the 4th option is a lot of employers are just going without insurance. So what I'm going to do is I'm going to tell you briefly about what the differences are in the 3. Next. The first option is being fully insured, and that is what most people are used to. So without reading this slide line by line, I want to give you an example of what fully insured means. Insurance 101 is really just nothing more than risk reward. Okay, so if you're a fully insured company, what is the risk? What is the reward? So if you're a fully insured company, the risk to you as the employer is nothing more than the premium you choose to pay. Okay, so if you're paying 50% of the premium, 75% of the premium, 100% of the premium for the employees, and $1 million claim comes in, your risk was your premium. That's it. The insurance company, typically a Blue Cross Blue Shield and United Healthcare, some of the major players that are out there in the fully insured space, they're the ones who have to pay that access $1 million claim. What is the risk to the employee? The risk to the employee is the percentage of the premium that you don't pay for them, whether it be 25%, 50%, et cetera, and the plan design that you choose. And what I mean by plan design is deductibles, copays, maximum out of pockets. From a risk-bearing standpoint, fully insured is definitely has the best risk reward ratio for anybody. The problem is, and it doesn't matter if you're a Republican or Democrat, I'm just going to state facts. Since the passage of the Affordable Health Care Act, fully insured premiums have gone up exponentially every single year. So they're becoming very, very expensive. And when that happens, groups will come to their broker or somebody like myself and say, Tim, what are my other options? Next. The next option that businesses tend to look into is becoming self-funded or self-insured. And self-funding can get a little bit complicated, so I'm going to kind of just give you the basics of being self-funded. I'm going to give you an example. Let's say that your business had 10 employees and your fully insured premiums were going up continuously over the years to the point where you've already raised your deductibles up super high to lower your premiums, and you're to the point where you might not be able to afford it anymore. So we take a look at possibly becoming self-insured, and let's say that you had 10 employees, for example. The way self-insurance works is you are going to create a specific deductible for each employee. And you may choose $10,000 or $50,000 or $100,000, but we use $50,000 for an example. So if you tell us as an insurance company, I'm willing to take the first $50,000 of risk for medical coverage and prescription coverage, before the insurance kicks in, your insurance premiums are going to go down drastically. Okay, so large corporations love to be self-funded. The problem is you're a small company, you only may have 10 employees. If 4 people go to lunch one day and get in a terrible car accident and go to the ICU and they're in the ICU for a week or two, can you afford $200,000 out of pocket? And quite frankly, most small businesses across the United States cannot. So there are some definitely advantages. There's to lower premiums being self-funded, but most small businesses across America cannot afford the risk. There's also a unique way in self-funding of where your premium dollars go. And this is very important to understand, to know what we've built at Exemplar next. When you pay your premiums to a fully insured company, 100% of those premiums stay with that fully insured company. So if we're talking about Blue Cross Blue Shield, you're paying $250,000 a year in premiums. And if you have a really, really good year and everybody's healthy, who keeps the money? Well, obviously, Blue Cross Blue Shield keeps the money. When you choose to become self-funded, when you're self-funded, your premium dollars actually don't go 100% to the insurance carrier. They go into 3 distinct buckets. The first bucket is your administrative bucket. And this is where broker commissions are built in, TPA fees are built in, which is a third-party administrator, et cetera. The second bucket, you'll notice, is actually, they call it stop-loss insurance. You'll hear it as stop-loss carrier. You'll hear it as reinsurance, but really it's nothing more than an insurance company that is backing your coverage after they reach the specific deductible, okay? And then the last bucket is your claims fund bucket. And the good thing about being self-funded is, first of all, you can see how much premium dollars you're saving, and that's the red blocks. The second advantage is the claims fund bucket. At the end of the year, if you have a healthy year, 100% of whatever's left over in that claims fund bucket goes back to you. But keep in mind, there's a lot of risk involved. If you run out of money in your claims fund bucket, you're paying out of pocket. Next. So what we did at Exemplar is we said, okay, we need to win more lives and bring you better reimbursements in commercial health. So what type of plan are we going to build? And we built what's called a level funded plan. And level funded plans really gained popularity after the passage of the Affordable Health Care Act. And to keep things very, very simple and for time constraint reasons, can just consider a level funded plan the best of both worlds. You're going to get a lot of the risk protection of being fully insured, and you're also going to get some of the advantages of being self-funded. So for lower risk groups, the premiums that we can save and the access to the claims fund bucket is going to be significant. And I'm going into a little bit more detail about our level funded plan in the next future slides. Go ahead, next, Alan. So how are we winning business across the United States? And if you recall at the beginning of the conversation, I'll put up our plan, what we built against any major plan that you see currently out there. We currently are competing with the Aetnas of the world. We're competing with the National Generals of the world, the Blue Cross Blue Shields of the world, and we're winning. And that's very important and key to our network members, because remember, when we win those lives, we're bringing you better reimbursements along with it. So how are we winning the business? There's 3 main ways that we're doing that. Number 1 is how we underwrite the group. So we do, there's a difference between what's called group rating and community rating. I'll go into detail on that in just a second. And then 2, and this is kind of the secret sauce, is our vertical integration. And then 3rd is the claims fund bucket. Next. So what's the difference between group rated and being community rated? Fully insured companies, they love to community rate. And what community rate, and I'm here in North Carolina, so we'll use Blue Cross Blue Shield North Carolina, for example. If I was a broker for Blue Cross Blue Shield North Carolina, typically I'm going to my customers every single year with double-digit rate increases. So if I went to your store and I said, you know, unfortunately you're getting a 16% rate increase, you may scratch your head and you said, well, Tim, this does not make sense. We were perfectly healthy last year. Why are we getting a rate increase? One of those reasons is because you're the lucky healthy group that gets to offset the cost for the unhealthy group in the community. Okay, so those communities can be defined by statewide groups. It could be region, it could be industry specific. But the fact of the matter is you're grouped in with a lot of other people in that community. We at Exemplar do not underwrite that way. We take a specific snapshot of the group and only the group. So if you're relatively healthy, we are going to reward you with a reduction in premiums just because we took a snapshot of your group. We're not offsetting your premiums with other people in the community. It is just you and your group alone. Just on this savings tip number 1, we're able to win business. It gets even better though. Next. This is me kind of pulling down the curtain on the insurance industry, and I could spend an hour alone just on this slide, so I'm going to try to go through it as quickly as I possibly can. These are all the hands that are in the cookie jar when you pay your premium, and I typically joke, these are all the BMWs that you're buying every time you pay your premiums, okay? So first you have a broker and an agent. A broker and an agent, if you've ever met a successful insurance agent, I promise you they're doing very, very well. The industry pays us very, very well for what we do. The second hand that's in your cookie jar is a third-party administrator. Every insurance company has a TPA that is administering your plan. Some of those TPAs, they own and have them in-house. Other insurance companies outsource those. Then you have your managing general underwriter. That is your actuary. That is somebody that's going to underwrite the case and make sure that the loss ratios are good for the insurance company. The next hand that's in the cookie jar is your stop loss carrier or reinsurer. And that's basically your insurance company that's backing the plan. And then, of course, you guys are familiar with the PBM side of things, so the pharmacy benefit management companies. And you guys understand the massive margins that they make. If you add up all these margins, and I don't have time to get into specifics, a lot of times these margins can be as much as 50 to 60% of your total premium. So if you do not think there's fluff in healthcare, you're absolutely wrong. The good news at Exemplar is we own or control almost all these margins. So if we're competing against another company, our broker, our agent, our TPA, the MGU, stop loss carrier to PBM, we do not need to be egregious in any one of these facets. Our goal is to win lives and bring in more lives and better reimbursements. So we've actually done business for free to bring more lives and better reimbursements to the network just to win business. And that's key. Next. And then the third way that we save, of course, is our claims fund bucket. If you remember, our level funded plan, you're getting the best of both worlds. So you're getting a lot of the protections of a fully insured plan, deductible choices, co-pays, tier structures on your prescription drugs, et cetera. But you're actually, the plan itself is actually built on a self-funded chassis. So I kind of tell people, and this is oversimplifying things, it kind of looks like a fully insured plan, smells like a fully insured plan, acts like a fully insured plan, but it's built like a self-funded plan, okay? So if you'll notice on the illustration, some of your premiums go into admin expenses, some of your premiums are going to the insurance company, and some of your premiums are going into claims fund bucket. The difference in the claims fund bucket between our level funded plan and being fully self-insured is you get 50% of the money left in your claims fund bucket at the end of the year. Next. So a lot of times we're competing against fully insured companies. And when I talk to businesses all across the United States, I basically promise them, I bet them two things. If you go to any major metropolitan area in the United States, two of those skyscrapers, one's going to be a bank and one's going to be an insurance company because they make funny money. Okay. So if you're a fully insured company and you're relatively healthy, why in the world would you not be level funded if I can save you 30 to 55% on your premiums alone, plus give you access to claims fund bucket? There's no sense letting those dollars sit at a fully insured company to add another story to the top of their skyscraper. Next. So we have a lot of different plan designs. We're actually up to 18 plan designs. This slide deck's just a little bit old. We just added 3 new plan designs in the last couple of weeks. So when we go out and talk to employers, really there's not a plan design that we can't create. We have deductibles as low as $1,000 and as high as actually $7,500 on our new plan designs. With a lot of different co-pays, we have 5 different HSA options. So when we go into an employer, we're not going to get beat by the competition because we don't have choices. Next. So here's the interesting part. So, our network members are calling us every single day and they're wanting us to shop their health insurance. And we're more than happy to shop their health insurance. And we've been able to save a lot of independent pharmacies and independent physicians nationwide a lot of money on their current health insurance premium. But that is not why we built the plan. If you're interested in getting a quote, we'll talk about that at the end of the presentation for your own individual company to save you guys money on your premiums. We can definitely do that. But remember, I wake up every morning saying, how am I going to bring our network members more lives and better reimbursements? And I have to win lives. So I just showed you how we win lives. Now what I want to do is I want to talk to you how you get paid better reimbursements, okay? And this is going to be hopefully very, very intriguing to everybody on the call. Go ahead, next. And if you will, just keep clicking on until you get to the end there. Okay, that's good. So really, we have 4 different ways that we are basically paying and bringing you better reimbursements. So number 1 is at point of sale. Number 2 is the split of net profits from our PBM. Number 3 is providing standard medical services. And 4th is health management programs. Next. And if you'll just keep on clicking, I'm sorry, there you go. So one thing that's really, really unique, and keep in mind, we just won Joe's Muffler Shop's business down the street from your pharmacy, okay? They're coming into your pharmacy with our Exemplar insurance card. We are the only commercial health plan in the United States right now that I know of anyway, that have wrote you, the pharmacist, the PharmDs, into our summary plan description as providers. Next. And basically what that means is you are allowed to bill our plan as a provider. So not only is our PBM going to pay you better at point of sale for every time you fill a prescription drug, and we're going to split 50% of the net profits at the end of the year that Exemplar's PBM makes, you can actually bill us as a provider for services. So next, Alan. And if you'll just click to the bottom, that'd be great. There we go. So I'm going to give you an example here. So you're a PharmD, and we're an ACA compliant plan. Under an ACA compliant plan, there's a lot of preventive services that we have to provide at zero copay. So our customers like to take advantage of those things. Certain things like your normal flu shots, your physicals, but I'll do diabetic screenings, for example. Traditionally, if you wanted to have a diabetic screening done and you have an ACA compliant plan, you go to your doctor, you get the diabetic screening test done, and our health plan pays the doctor. Well, we wrote you into our plan as providers. So if you are allowed by the Board of Pharmacies to do diabetic screening, by all means do diabetic screening in your store, and you can actually bill us as an insurance company and we will pay you for that service, not just the doctor. So it's just another revenue stream for your pharmacy. Next. So here's just a kind of an example. We pay basically we use reference-based pricing a lot on how we pay our providers. We typically pay anywhere from 130 to 150% of the Medicare allowable amount for these particular services. So just here's some real quick examples. For a flu vaccine, the Medicare allowable amount is $26.65. We reimburse 130% of that, so we'd be paying $34.64. You provide a vaccine, Medicare allowable amount is $10.63. We're going to pay 130 to 150% of that amount, depending on the geographic area that you're in, which is $13.81. So total reimbursement is $48.45. Just one example. Next. The other way that you can also add additional revenue to your pharmacy is you can set up a collaborative practice agreement with a local physician in your particular area. And all this really does is this expands your opportunity to bill for more and more services that might not be covered necessarily under your PharmD license, but it would be covered under the collaborative practice agreement. I also have Kirby Taylor on the call with us as well. She heads up our medical service organization at Exemplar. So if you guys have any questions on, if you really want to ask some detailed questions on how to set up a collaborative practice agreement so you can expand the possibility of billing for your services, she's on the call with me as well. She can answer those questions at the end of the call. Next. All right, so you can basically see an office visit level here, and you can plug in any diagnosis. If the Medicare allowable amount's $45, we're basically paying the 130% of that, so you would basically make $58.50. Once again, you would need a collaborative practice agreement in order to provide some of those office visits, okay? All right. So disease state management, this is a big one as well. So if you look here, the pharmacy managing the patient will be reimbursed $81 per month for the care of that member for disease state management. So the average time spent with the patient per month is about 30 minutes. So the pharmacist's hourly rate for this that you can bill is $60. The monthly reimbursement per patient's $81. If you do the math, if you had a lot of diabetics that you were seeing that had our plan and you managed 10 of those patients per day, average 20 working days per month, which is 20, you can take a look at your return on investment through our plan. You're making, over 10 grand a month just doing disease state management for diabetes. Okay, next. Okay.
All right, Tim, we've got a question here.
Yes, sir.
That's come in. Years ago, pharmacists built Community KRX Part D plan, which I believe was owned by the NCPA. After several years, pharmacists promoting CCRs and built on the backs of pharmacists, it was sold to Express Scripts. What will keep this idea from being built up and then sold?
Yeah, sure. So I get that question all the time. So I'm going to go and I'm just going to clarify a couple of things. So Community Care RX was in my opinion, it was built off the backs of independent pharmacies. I think they started in 2012. They ended up selling late in 2013. And actually they weren't sold to Express Scripts. They actually went under the CVS umbrella, and they actually sold out to what's now known as Silver Script, not Express Scripts. And Silver Script to this day is still the #1 Part D plan in the United States. WellCare looks like they're probably going to take them over this year, but Silver Script is still plugging along strong. So on the Medicare side, what keeps us from selling it? We are not publicly traded. We are privately owned. We have no intentions of selling. We have 19 companies under the Exemplar umbrella. Every one of those companies is only successful if independent pharmacies survive. Okay. From our insurance company to our wholesale drug distribution company to, we own independent pharmacies ourselves, to our medical service organization, the independent physicians. The Medicare Part D plan is the first product besides our group product that you see here that we launched. There is no intention of selling it. If we sell it, all our other companies go by the wayside. One of the companies that I owned and how I ended up becoming part of Exemplar was I owned 100% of it. And when I started working with Exemplar, it was a key piece of the puzzle on the insurance side. And I sold the company to Exemplar because they were fearful that we were going to be successful, so successful that I would be tempted to sell it. And I said, I believe in what Exemplar is doing wholeheartedly. I have no problem selling the company to Exemplar. And so for peace of mind, I sold my company to Exemplar because they were scared I was going to sell it. There is no intention to sell. Now, is there that anywhere that we could put in writing? Absolutely not. But that's the best answer that I can give you from that standpoint.
Okay. Please feel free to push in your questions here. We'll be happy to keep the lines open here a while to review any questions that you have here. Another one that's come up is, are there any states that you do not operate within?
Sure. Yeah. So we're licensed in 47 different states. So take Alaska, Hawaii, and New York and remove them from this. As far as the group product goes, it's Alaska, Hawaii, and New York. We are in every other single state. We can go down to as low as 2 lives in most states. However, with level funding plans, the states do give us restrictions. So for example, in North Carolina, we have to have at least 20 eligible employees for level funding. But most of the states we can go down to 2. So yes, we're not in New York, we're not in Alaska or Hawaii. On the Medicare Part D side, I know we had a question earlier about the Community Care RX. We have launched in Texas, have CMS approval in Texas and North Carolina for this upcoming selling season. So if you're in North Carolina, Texas, congratulations. You will have a standalone Part D without any DR fees. And we are currently in the process right now behind the scenes of rapidly trying to figure out what states we're going to expand into for 2022.
Question here. Tim, you mentioned in savings number one, the group rated bucket, and how you guys do that. And if a healthy group is paying premiums, those premiums are going to be less. But over time, what if you have a really bad year? How obviously you're going to be probably paying more out of pocket. So is that true?
Yeah. So let's say that we were working around a pharmacy that's on the call today, and we won 10 companies around that pharmacy this year. Is it realistic that they're going to be on our level funded plan for 10 straight years? No, it's not. It's just not. Okay. And the reason, well, Scott, you alluded to it, is if you have a bad claims year and you cost the plan millions of dollars, the next year you're going to get rated so high where it's not going to make financial sense for you to continue with our plan. The nice thing from a financial advising standpoint, what I advise people to is that's the beautiful thing about, there's a lot of good things that happen with the Affordable Health Care Act, and there's some bad things that happen with the Affordable Health Care Act. The good thing is if you're a small business, they're not asking you health questions, right? So you can take advantage of our level funded plan while you're a relatively healthy company. If you have a bad claims year, you have people start taking specialty drugs. You have maybe somebody had a premature baby that was in the NICU unit. You just had some terrible, crazy, unforeseen accidents happen. The very next year, what we'd recommend is, hey, you need to go back into the fully insured pool, and you need to be in the community rated pool because you're unhealthy. And to lower your premiums, you need those healthy groups to offset those premiums. So that's the strategy there. Now, it leads me into my next thought. You do not have to be a perfectly healthy group to save money on this plan. You just have to be relatively healthy. So let me tell you, instead of telling you what relatively healthy looks like, let me tell you what unhealthy looks like to us. Specialty drugs. Specialty drugs are going to raise our premiums to the point, if you're taking Remicade and every 90 days it's a $46,000 injection, imagine what we have to charge in a premium just to cover somebody like that. So specialty drugs are not always a kick out, but they're going to really rate up the plan. And then the other thing is a combination of disease states. You have cancer. If you had cancer, it's not a problem with us. If you've had a heart attack, not a problem with us. If you're a smoker, not a problem with us. However, if you've had cancer and a heart attack and you're a smoker, there's a trend there of being unhealthy, and our underwriters will rate it up. So combination of disease states and specialty drugs are the two biggest things. Then there's an outlier, and that's premature children. So if you have a lot of people in the group that may be pregnant at the time of application, that is a risk concern for us because premature babies are very, very expensive once they go into the NICU unit. Great question, Scott.
All right,
I got one more follow-up here.
Go ahead.
You mentioned savings number two and the vertical integration, and you've kind of been alluding to this, my question is the transparency. You mentioned transparency in the presentation. As a pharmacy looking to get on board here, tell me about that transparency. How can they be confident that transparency, because you mentioned the massive amount of margin Exemplar is controlling. Tell me about that transparency if you're a pharmacy owner looking at this as compared to the other providers. Because as we know, the healthcare system is not very transparent, and that's been an issue in the industry as a whole.
Yeah, that's I could spend an hour answering that question, but you're exactly right. I didn't hear the word transparency a whole lot until I started working in the pharmacy world, because everybody says they're transparent, and even especially the PBMs that are out there. And I can tell you what I've learned just digging down in the weeds with this whole transparency issue is companies are only as transparent as what they want to show you. Okay. So one of the things that we do when we go out and we win a group's business is we will literally, and it does, whether it's a 5-man group or a 500-man group that we're doing self-funding on, is we literally show them what it costs for us to do it for nothing. I mean, you can't get more transparent than that. This is what it costs for us to do it for nothing. And then we backfill it and we say, is it okay if we make X? That's how we're winning business out there. So, from a PBM standpoint, I won't mention the city's name. We're in the RFP process with a big corporation. Well, they're actually a municipality here in North Carolina. They have 4,000 employees. Their current PBM is Optum. If we just won the PBM side of the business and not the other four kind of hands that were in the cookie jar, we're saving that municipality $3.7 million if we did it for free. And we showed the municipality, if we do it for free, this is what it will cost. And then we'll build in margins accordingly. Now, we want to save as much margin on the PBM side as we possibly can, because that's what's being reimbursed back into the network, obviously, at the end of the year. But, it's kind of a give and a take. Do we do it for free and saving $3.7 million and then get 4,000 people that are using our card at your store? Or do we raise our margin so high where we might not get business altogether? So the ultimate goal is to win the lives. If you remember the healthcare circle that CVS and Walgreens built, we need to win the lives first, and then the dollars will come. So hopefully that answers your question, Scott.
Okay. Next question comes from Leslie. Leslie wants to know, are your plans also accepted in paying any willing provider the same? She says she asked due to the Oklahoma Patients' Right to Choose Act.
Yeah, sure. So it really depends on the network option that they choose on our plan, Leslie. So we have PPO options. We could build a plan, our level funded plan, and rent any PPO network that they really want us to. Some of the more popular PPO networks that we have are the PHCS multi-plan network. That's the largest PPO network in the United States. The Aetna First Health Network, the Cigna Payer Network, MedCost Network. So if you wanted us to rent a PPO, we could. And then, of course, you're bound and by the PPO's terms. However, we push very, very hard at Exemplar reference-based pricing. And reference-based pricing is where we basically use the Medicare allowable amount. In every county across the United States, for every procedure, Medicare has determined this is what we're going to pay providers and facilities. And that's what's called a reference base or a reference point. And if we use a reference-based pricing option, there are no networks. So our members, our customers can go see any doctor, any hospital that they want to. And we as a health plan, when we pay them a multiple of that Medicare allowable amount, typically between 130 and 150%, which in turn at times can lead to balanced billing scenarios. So for example, an average joint replacement here in North Carolina costs $60,000. If we rent the Cigna PPO network, they get about a 50% discount. So now we're looking at $30,000 that we have to pay as a health plan. And that sounds pretty good at first glance until you know that Medicare only pays $9,264. So that's why we like reference-based pricing. It lowers the overall cost of premiums, and it will save more money in the customer's claims fund bucket. So Leslie, to answer your question, it really depends on if they're choosing a PPO network or a reference-based pricing option. Good question.
All right. Adam has a question. Adam says, is all of your medical pricing Medicare allowable plus 130%? How is the pharmacy contracted for reimbursement? Off NADAC, AWP, MAC, or what?
Okay, so the reimbursement, so I'm not going to speak to the pharmacy side on the AWP MAC. That's where I get in trouble. We'll have to run that up the totem pole on the pharmacy side of Exemplar, but I can answer the reference-based pricing question because that's in my wheelhouse on the insurance side. Is it always 130%? No, it's not. So what we do is we typically right now are paying about 150% nationwide. But we have third-party vendors that our TPA uses that tell us in this particular location in the United States, facilities and providers are accepting this amount of the Medicare allowable amount. So it's been about averaging around 150%. But, if we do business in Philadelphia, Pennsylvania, we might have to go up to 180%. When what we're trying to avoid in those scenarios is the balanced billing scenario. So is it locked in at 130%? No, it is not. It will be locked in, but it's locked in depending on where you're at geographically. And if you want to know that. That'd be a question for Kirby or the TPA, because I'm not privy to all the areas of the country exactly what we're paying on the RVP, but it's not locked in at 130, no sir.
All right. Courtney has a question. Would independent pharmacies be considered a preferred pharmacy with Exemplar, and patients would have lower copays than going to CVS or Walgreens?
On our level funded plan, no. Okay, so you're not considered a preferred pharmacy per se. They're going to be able to. So on our level small business plan, they can go to any pharmacy that they want to. However, how we reimburse those pharmacies are totally different. So we're reimbursing your pharmacy at point of sale at a much greater rate than we are obviously the CVS's and Walgreens of the world. Okay. Now, on the self-funded side, we didn't talk about self-funding a whole lot today, but on a larger group that wants to go fully self-funded, that's exactly what we want to have happen. We'll actually go to that employer and we'll say, hey, do you mind? We can do it in a lot of different ways, but a lot of times we'll do it in what's called a copay differential. So we'll say, can we design the plan where if they use your local independent pharmacies, that it's a $10 copay for tier 1 generics, and we pay $20, they pay $20 if they go to CVS or Walgreens. That's exactly what we want to happen, because that money is coming out of their claims fund bucket, which means that employer is going to steer them to your store. At the end of the day, though, it's up to that business owner whether or not they say yes to that copay differential. At the end of the day, as long as we win the business, that's a win for us. That's a win for the network. If we can get the copay differential built on top of it, that's just gravy on top. Good question.
All right. Greg has a question. Says, how can we understand your footprint in my local market?
That's a great question. I'd have to know where that local market is. So from a distribution standpoint, we have agents and brokers all across the United States. We just signed a contract with the largest FMO in the United States. They have 275,000 agents nationwide. We're called Integrity Marketing. If you want to look them up, feel free to look up Integrity Marketing. They're buying up every successful, what they call FMO, which is a field marketing organization. They're really a wholesaler for the insurance companies, but they control large distribution of agents. We at Exemplar also have our own captive sales force all across the United States. So to understand the footprint, I'd have to understand where your local market is. Now, what we're looking for when the pharmacies join our network is we're looking for active members of the network. It is very, very difficult, and I'll put my insurance agent hat on. It is very, very difficult for me to pick up the telephone and start cold calling businesses around your local area. Studies have told us that you as the independent pharmacist are the most trusted healthcare provider in the healthcare industry. They're going to your locations because they trust you. You're providing great customer service and you're keeping them healthy. You've built great relationships with these people. Surely you know some business owners in your community that may have Blue Cross Blue Shield that are using your store. They may have Aetna, they may have National General, they may have United Healthcare. We would love to talk to all those people, and a warm introduction goes a long way. You provide that warm introduction to us, we will do everything in our power to win that business.
And with respect to options, as you can see on the screen here, Todd Sykes, who's with Freedom Benefit Sources, also can be contacted. I know Jerry Callahan had a question about how Exemplar can be contacted. So certainly Todd is one, and Tim, you may want to talk about that further here. And by the way, Greg says he's in Dalton, Georgia, with respect to that local footprint situation question that he had a minute ago, if that makes any difference, Tim.
Where at in Georgia?
Dalton, Georgia.
Dalton, Georgia.
Yeah.
I'm familiar with Dalton, Georgia. I'm trying to think what county that's in. But it's actually funny that you said that. We actually have a lot of independent pharmacies that already have our group health product in Georgia. Georgia's actually what we call a red hot state. So we have cold states and we have red hot states where our product is winning business. Right now, close to North Carolina, I would say South Carolina and Georgia are red hot states. We beat Aetna on our last premium by 95% in Georgia. So great market for us. Back to the broker question, and what does your footprint look like? Guys, I've been in the insurance business for 25 years, and I've had distributions with as many as 4,000 agents under my, I call them hierarchy, that I'm working with day in and day out. Insurance agents are not created equal. Some insurance agents have no business being in the business altogether. That's why some insurance agents get a bad rap, and some people treat them like used car salesmen. But then again, there's other insurance agents out there that truly care about their customers. They're truly independent, and they're going to do the right thing for their customers. Every once in a while, I come across one of those agents. For every 20 agents that I meet, I might find one. And, one of the reasons, I'm happy to be presenting today with Alan is I met Todd. And I met Todd through Alan. And I can tell you, if you're wanting to talk to a broker that really, really understands the business, really is going to do the right thing for the network, is going to do the right thing for your store, and more importantly, win the business, by all means, you see Todd's picture on here. Please write down his telephone number, have his email address handy. Make sure you're funneling all the leads that you possibly can through Todd. Todd and I probably speak 2 or 3 times a week personally. He communicates very, very well with our whole entire staff out of High Point, North Carolina. And if you're looking for somebody to get the job done, I would put your money on Todd Sykes to do it. So, anyway.
A couple of wrap-up questions here. We've got kind of on a tight time frame.
Yes, sir.
Courtney wants to know, what do we have to do to become members of the network?
Sure. To become a member of a network is very, very simple. There is no risk to joining the network. You simply sign what's called a business associate agreement, and you can go to exemplarhpo.com. And that stands for Healthcare Partnership Organization. So it's exemplarhpo.com. And there is actually a link on there that says join. Once you click on that join link, one of the Exemplar network members will actually reach back out to you, talk to you about your needs for your particular location, whether you want help in the Medicare bucket, the commercial health bucket, et cetera, and answer any of those questions that you may have as far as joining the network goes.
All righty. And Joy, you had a question about how can you get access to this webinar? This webinar, since you registered, will be emailed out to all registered members of this webinar. So it'll probably come out within the next day, day and a half, so be aware of that. And we got one further question from Matt, and we're going to have to go. Matt, I'm just going to read, it's kind of long. He says, warm introductions to community businesses. It would be beneficial to us to know and understand exactly what Exemplar's PBM and or distributor can do for independent pharmacies from a dollar standpoint, i.e. no DRs, no negative reimbursements, etc. If we can see that it's worth having in our community, then we can provide the leads and warm introductions. Seems as though we should have a follow-up session with Exemplar to have someone speak to the PBMs and distribution side. Not really a question, but more comment. But a good comment, Matt. Appreciate you putting that out on the floor. Tim, you want to comment to that, any?
Yeah, absolutely. And that would be the logical follow-up statement or the logical follow-up question. So I'm glad you brought that up. What I suggest you do is what I recommended earlier. Go to exemplarhpo.com. All our contact information is there. Obviously, your question had to do a little bit about the PBM, had a little bit to do about DIR, had a little bit to do about reimbursements. And we have different divisions, of course, for all that, PBM, medical service organization. So call the 800 number that you're going to see on exemplarhpo.com and just, fire the questions away, and we'll make sure that we get you to the right department to really get down into the weeds to show you exactly what those payments and reimbursements look like. Good question or statement.
Yeah, it really was. And Tim, that wraps it up for today. We certainly appreciate you and Exemplar being a part of the Master the Margin series. As we continue to kind of drill down in areas to help pharmacies, notwithstanding either for revenue generation perspective or from a cost control arrangement, this certainly fits the bill. And again, we appreciate very much you guys being on with us today, and we appreciate everybody being on the call today. And again, if you have any questions that you want to follow up with us, please go to Ask Sykes at CPA.com. Here is our information for Scott and Alan and myself. You can follow us on Twitter. We email direct here. We've got hundreds of videos. All we do is work with pharmacies all over the country, industry specific, We're some 45 people. We'd love to talk to you if you have any questions. And again, we appreciate everybody being on the call today and hope everybody has a great afternoon.
Thank you.
Thank you very
Thank you
much.
so much.